treat the symptom, what you end up with is somebody who you make chronically ill for the rest of their lives. If you can in turn understand what's causing the problem, then you can begin to solve the problem. And indeed, what we found is a huge number of these conditions are really a result of an infection that subsequently trips off the immune system. And now what happens is the infection may have been missed, be it Epstein-Barr, mono, or Lyme disease, or strep, but the infection was missed. But you also now have an immune system which has gone rogue. And the immune system is now part and parcel, if not the primary issue in terms of the problem.
That was Dr. Gary Kaplan, and you've landed on the Me&my Health Up podcast. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. The purpose of this podcast is to enhance and enlighten your well-being. And Dr. Gary Kaplan is going to be doing that for you. Dr. Gary Kaplan is a clinical associate professor at the Georgetown University School of Medicine. He's the founder and medical director of the Kaplan Center for Integrative Medicine and the author of Why You Are Still Sick and How Infections Can Break Your Immune System and How You Can Recover. He is a pioneer and leader in the field of integrative medicine. Dr. Kaplan is only one of 19 physicians in the entire US of A to be board certified in both family medicine and pain medicine. In November, Dr. Gary Kaplan will co-chair an international conference on the new developments in understanding chronic illness, the role of immune dysfunction and infections. And yes, we're going to be interviewing and discussing the topic of the immune system and how you can still be sick, although they're saying that you're not. So what's wrong with you? So Dr. Gary Kaplan is going to explain to you what could be possibly going wrong and how your immune system may be a bit dysfunctional and how you're not crazy. Yes, you are sick, okay? And so for anyone out there that may be experiencing long COVID, struggling to get over COVID, or has chronic fatigue syndrome, or may have post-treatment Lyme syndrome, or PAN, or PANDAS, fibromyalgia, or depression, this episode is for you, because we're going to be discussing how the immune system can become dysfunctional and work against you and make you feel sick, and what you can do about it to get yourself back on track. So buckle up and enjoy this episode with Dr. Gary Kaplan. Welcome on the Me&my Health Up podcast, Dr. Gary Kaplan. How are you today?
Excellent. Thank you very much, Anthony. I'm delighted to be here.
And where are you joining us from?
McLean, Virginia, just outside of Washington, D.C.
Fantastic. I love that place of the world. I went there many years ago with my father and was in awe with the historic sort of, buildings and the beauty of the city. It's a fantastic city.
The area is beautiful, and right now, we're just coming out of spring into summer. It's gorgeous. Everything is in bloom, and everything is green and luscious.
Fantastic. We're going into the cooler part of the year, being on the opposite side of the world. And it's certainly getting a bit cooler, but nice. Still crisp, but beautiful in its own right. And I'm really glad to have you on the show today. I see a lot of clients with chronic fatigue, depression, and pain, all areas of which you have delved into in terms of your research, and you've done a lot of study in immunology. So I'm really keen to explore immunology and what people can do to rebuild their immune system. And the other side of the coin is how to keep it optimal. If it's not busted, how to keep it really tuned up, so to speak.
One of the interesting things that's happened is the flip side of my work is longevity and inflammation, because basically aging is an inflammatory process. And from what we've learned from these very sick individuals, we're able to take this to ourselves and stay healthy and stay vital and strong much longer. So it's information that really moves across the entire spectrum from our crew that's very, very sick, but also to keeping ourselves healthy, strong, and vital for many, many years.
Oh, fantastic. So you're working with the sort of reactive to the response to someone being sick, but also then on the flip side is helping those proactively with their health to live longer and higher quality life.
Absolutely correct.
Fantastic. So just to bring our listeners up to speed in terms of your career, how have you arrived at what you're doing today?
It's a long journey, but basically my background specialties our family medicine and pain medicine. Early on, we were doing work with chronic pain and finding that there were a lot of people who were very depressed at the same time. And the comorbidity, the occurrence of chronic pain and depression, 60%, it's very high. So we started wondering what that was about, and I started making inquiries with colleagues over at Georgetown. And what we eventually came around to is understanding that what we were looking at was a inflammation in the brain, neuroinflammatory disease. And so we began to study what we were looking at in terms of inflammation. Now, what that led to is my first book, which was Total Recovery, which is talking about reframing chronic pain as a neuroinflammatory, brain inflammation, brain on fire issue. We have subsequently found that as we've continued our explorations that we're really looking at a whole series of diseases that have been labeled by their symptoms. So chronic fatigue syndrome and fibromyalgia, which are chronic pain syndromes, and post-treatment Lyme syndrome. Major depressive disorder isn't a disease. Major depressive disorder is the symptom. Now post-COVID, which has been unfortunately a very much of a boon for us in terms of scientific research and understanding a lot of these people really suffering with all of the above. And also working with kids who have the PANDAS, pediatric acute onset neuropsychiatric disorders, which can be incredibly terrifying and disabling. And all of these conditions that actually can be extremely disabling, and with the patients we work with, most of them have been very sick for a long time. The problem is, if we call these diseases by these different names, what we end up doing is treating the symptom. When you treat the symptom, what you end up with is somebody who you make chronically ill for the rest of their lives. If you can understand what's causing the problem, then you can begin to solve the problem. And indeed, what we found is a huge number of these conditions are really a result of an infection that subsequently trips off the immune system. And now what happens is the infection may have been missed, be it Epstein-Barr, mono, or Lyme disease, or strep, but the infection was missed. But you also now have an immune system which has gone rogue. And the immune system is now part and parcel, if not the primary issue in terms of the problem. And the immune system gets into two things. But let me tell you a quick story about how dramatic this is. All right? Two, if I may. One is a young man who came to me when he was 17 years old, suicidally depressed, tried to hang himself. He had been through a number of psychiatric treatments without success. He had been hospitalized, again, without success. And subsequently, they sent him to me because I'm a neuroinflammatory guy, and they said, what do you think? Well, in working him up, what I found was he has celiac disease. Celiac disease is an autoimmune disease to gluten, to wheat. And about 5% of these people will present with only neuropsychiatric symptoms and not intestinal symptoms. So here was a kid whose problem wasn't depression and suicidal. He was sick because he was eating wheat. We took him off all gluten. We cleaned up his gut. In the course of a year's time, because it takes a while for the brain to quiet down, complete recovery. Depression was gone, off all antidepressant meds, 100% normal kid again. Another kid that I saw working with now, very bright kid, one of the major universities in Scotland. And 2 years ago, he suddenly develops hallucinations. He's hearing voices. He's seeing things. He's getting suicidal, severely depressed. They treat him for all of these things, and they're medicating him, and they've pushed all this stuff into the background. And he's kind of functional, but he's not doing so good. So I take a look at him, and again, I work him up from an infectious issue, from a neuroinflammatory issue. What he has is Bartonella, which is a tick-borne disease, and he has toxoplasmosis. We treat those, and I'm still in the process of working on him, but we started treatment about 4 months ago. Last month when I saw him, all the hallucinations were gone. First time in 2 years, he's had no hallucinations whatsoever. So as the infection gets cleared, and as we work on his immune system, my expectation is he'll be 100%. So we need to look at these people who are coming in with these different symptoms with fresh eyes and say, wait. Are we in fact looking at a neuroinflammatory disease? Are we looking at an infection that we missed? Or toxins in some cases? Mold toxicity, heavy metals can be doing this in some people. And now we have a way of actually treating these people and giving them a path to full recovery. So this is critical. We're talking about tens, hundreds of millions of people worldwide suffering with all of these different conditions, this Tower of Babel of different labels that we put on people. But we're not being able to offer them solutions because we have been thinking about this wrong. We have been thinking about this as the symptom, not thinking about it as the underlying disease, which in the case of many of these people is a broken immune system secondary to an infection. We identify that, now we've got some answers for them. More importantly, we have solutions to be able to see them completely recover.
And the other one is, I guess, in addition to the infection, is just a chronically inflamed lifestyle, right? Or in terms of food and sleeping and not exercising and really driving that inflammation without the infection.
You're absolutely correct. And one of the things, so it's a little bit more complicated than infection, broken immune system, and disease. It's genetics. So what's the setup in terms of this? But the other piece of it is a thing called epigenetics. Epigenetics is this idea of on top of. It is our environment that stimulates us, our nutrition, our stresses, sleep, exercise or no exercise, that turn on and off different genes and cause them to express. That can either strengthen or weaken our immune system. So the basics always apply. You've got to get enough sleep. Enough sleep defined as 7 to 8 hours a night. Unless you're a teenager, then 9.5 hours a night. You've got to make sure that your nutrition is appropriate. I just was reading an article looking at vitamin D. If you develop COVID and you came in with low vitamin D, your odds of getting long haul COVID was about 5 times greater than if your vitamin D levels were normal. And by the way, a normal vitamin D level in the United States, at least, should be about 50 to 80 nanogram per deciliter. Not sure what I would translate it to in your system, but about that. So we have to rethink this whole thing in terms of looking at the whole setup that led to the breakdown. And so exercise becomes extremely important in order to maintain a healthy immune system. And there are basic things in terms of, how you want to keep the immune system healthy. Saunas in terms of detoxification, using cold ice baths, do amazing things to tonify the immune system. Cold being defined in your terms as about 15 degrees Celsius, around that temperature, 60 degrees in ours. But all of these things, about 5-10 minutes, a couple of times a week, will tonify your immune system. Same thing with intermittent fasting. Because we eat too many calories, we actually burn out our mitochondria. And so we can actually replenish ourselves by paying attention to nutrition, exercise, sleep. All of these things are essential to staying healthy. And then there are supplements that can actually be extremely healthy for us as well, and using things like resveratrol and using things like NNM to build our immune system. We need to make sure that we've got adequate magnesium in our system, and many sleep problems can be solved simply by taking some magnesium at bedtime. That may solve the problem. You also may be able to solve problems with constipation by taking adequate magnesium. So we build, it's not just a function of we find bugs, kill them, and work on the immune system. We talk in terms of their entire lifestyle. We clean up people's diets. We get them exercising to the extent that they can. People struggling with chronic fatigue can't do too much. And so the key on these individuals is always pacing, not pushing. You don't want them crashing. The myalgic encephalopathic piece of this is where the brain gets so inflamed because you've overdone that you completely crash. And overdoing, by the way, can be a result not just of physical exercise, but of mental. In the course of a championship match at a grandmaster level in chess, do you have any calories they burn sitting there for 4 hours?
No idea.
About 5,000 calories. The brain is the most metabolically active organ in the body. So it's not just the physical activity that can exhaust you, but trying to read, focus, concentrate can also exhaust you. And so we need to work on making sure we're pacing our people so that they're not crashing, because I don't want the brain getting reinflamed. That crash, that brain fog, focus, concentration, fatigue, crushing fatigue that these people have is a result of the brain becoming inflamed. I had, in fact, had one kid, his problem was mold toxicity. So this is another environmental poison that we get exposed to. He was particularly sensitive to it. And he was exhausted. Severe fatigue, had to drop out of school, couldn't go to school in high school, and couldn't read for more than 10 minutes. If he read more than 10 minutes, he completely crashed. Him, we took back and we said, okay, stop, 5 minutes, and you take a break for 15. And then you can read for another 5 minutes. But I don't want you crashing. So we worked on pacing to get him up. And we also detoxified in terms of the mold sitting in the system. And he's graduating Baylor next year, so the university. So, we can see these people recover completely and get their lives back. And that's what's important.
It's really great that you take that integrative approach and really get to the underlying driver behind the condition as opposed to just treating the symptoms. Because in those two earlier case examples you mentioned, both mental health related, and a doctor could have easily just referred them to a psychologist and say, deal with their psychology around hallucinations and depression. However, there was an underlying driver, and if that wasn't dealt with, the psychologist in terms of advancement and making progress would have been very limited. So it really does take that fully integrative approach in terms of not just looking at the symptoms and treating the symptoms, but getting to the underlying driver behind the condition. And that's a lot of
you're
what
absolutely correct.
Yeah.
We have to rethink these things.
And in terms of autoimmune conditions, so there's certainly, like you hear a lot about, I guess, growing numbers, and obviously today we're able to test for autoantibodies and things like that, and we've got a greater level of awareness. So, that could also be somewhat making us, or seeing that the numbers are growing. But there's also, you mentioned before this, chronically inflammatory sort of lifestyle that some people live. And then on top of that, getting infections that aren't properly resolved or dealt with. So what sort of correlation do you see with inflammation and autoimmune conditions and the rise of these autoimmune conditions that we, so a couple you've mentioned, fibromyalgia, chronic fatigue can be, I guess a symptom of autoimmune condition. You mentioned celiac disease or syndrome. So what have you seen in your research in terms of the correlation with our lifestyle?
You have to think about what inflammation is, because inflammation is a lot of different things in the body. And so if you skin your knee and the knee gets infected and it gets all swollen and pussy, inflammation there is caused by a bacteria, and an antibiotic would be appropriate to treat it. If you have hay fever, all right, you have allergies, itchy eyes, runny nose, that's not caused by an infection. That's caused by an immune reaction to pollen, foods, whatever that you're allergic to, in which case you need to treat that by removing the offending agent, but also antihistamines will be useful. In the brain, inflammation is mediated by two things. It's mediated on one end by the innate immune system, and that's made up mostly of cells called microglia and mast cells and astrocytes. So there's dealing with the innate component of the immune system in these individuals, and then there's the acquired immune system, which are the antibodies, and dealing with that. Now, when you talk about this business of autoimmunity is very complicated, because we're used to classical autoimmune diseases. We're talking rheumatoid arthritis, or lupus, or Sjogren's syndrome. There's a whole list of them. But these autoimmune diseases that have been tripped off by infections are frequently brain antibodies that focus on the limbic system. So they're rather unique antibodies that go to very specific areas of the brain. In kids, they produce some really bizarre behavioral problems. They produce what's called pseudo-seizures. We call them such not because they're not seizures, but because on a standard EEG, electroencephalogram, we don't see them. What goes on with these kids is it can be quite terrifying and very dramatic. And what we see different, though, in adults is that they don't have the same dramatic presentation, but they still have a very severe presentation. They can be completely crippled in terms of being bedbound and not being able to get out of the house. It's extreme light and sound sensitivity, headaches, chronic generalized pain. These poor people are in depression, and it's usually all of the above, not necessarily one thing and not the other. And when you're seeing all of that stuff, you're looking at a generalized neuroinflammatory process. And so then what you need to do is back up and start understanding how the brain got inflamed and what it is we need to break it down. Now, part of it is getting rid of all the offending agents. We talked about environmental toxins like heavy metals, and we talked about mold briefly, but also clearly infections that may be there that were not properly identified and treated. And then you have to treat the immune system. And then treating the immune system, there's a number of things you can do in order to modulate the immune system. Sometimes using metformin, which is a glucophage, it's a diabetes drug, but it turns out that it modulates the acquired immune system. So use of metformin can be very useful in this population. And by the way, it'll probably be the first anti-aging drug, because it's very helpful in terms of helping us quiet our immune system so that we're not as inflamed and aging as we're having. So things like metformin. On the innate side, you want to look at things like low-dose naltrexone. Naltrexone at a high dose is something that we use for reversing narcotic overdose, but at very low dose, 1.5 to maybe 3-4 milligrams, that is extremely effective at quieting the microglia in the innate system. Also using things like antihistamines to address the mast cells. There are other medications and supplements that you can use, luteol and others, that will help stabilize and quiet the mast cells. So there's lots of things we can do. We're taking both from pharmaceutical and from supplements and from lifestyle in order to quiet all of this inflammation. And then we can talk about getting you completely recovered.
Yeah, so it's really a case-by-case basis in terms of how you work with clients. There's not a one-size-fits-all. If they're coming in saying, I've got chronic fatigue, it could be a number of, things that are driving that or underlying that. So it really requires, thorough testing and working out, what is the driver behind that.
And by the way, one of the setups for all of this stuff can be childhood abuse and extreme stress, PTSD, because we know that children that come out of abusive environments, about 15% higher risk than the rest of the population for developing autoimmune disease, about 25% higher risk for developing heart disease and diabetes. This stuff has very severe, these psychological assaults have very severe impacts on our health. And indeed, I saw a woman today who's chronic fatigue and she's depressed and trouble word finding, focus, and concentration. I told her what she needs to do first and foremost is get out of her marriage. She needs to get divorced. Then we'll see what's left and what we need to do. But she's under so much stress and she's so overwhelmed by what's happening in her life right now in her marriage. The medical stuff almost pales in the side. And she's never going to be able to rally her own resources in order to be able to heal as long as she's living in this incredibly stressful environment. So all of this stuff, you're really correct. You need to individualize the therapies and you need to get the story. You need to take time to really understand the totality of what's going on with someone when they've been this sick for this long. And when you do that, you can start to put things together. Okay, let's do this. And then you pick out your strategies in terms of what you're doing. But it is about putting together a comprehensive program. It's about treating the whole person and not just treating bits and pieces and the symptoms, because the symptoms is why they end up in my office to begin with.
Oh, fantastic. It's a great segue into how the listeners can best connect with you before we get on to your final concluding words around what they can do in a preventative sense. I know you've mentioned a few things already, but really keen on you sharing with the listeners how they can best connect with you and get support and help.
So, I've written 2 books, Total Recovery, which kind of outlines conceptually what this is about. That was about 5 years ago. But my most recent book is Why You Are Still Sick. And that outlines pretty much a step-by-step of the how-to, what labs we use, what procedures we use to help you understand how you can diagnose yourself and how you can help yourself get better and how you can have a better conversation with your physician, your healthcare provider, to really get better. So Why You Are Still Sick, and that is available at Amazon. We needed to put that out there because there's only a couple of us in the clinic and lots of people need help with this. The other thing we're doing is I run a foundation called the Foundation for Total Recovery, brainonfire.org, and we sponsor a yearly meeting on this. Now, the meeting is focused primarily for physicians and researchers, so it's a pretty high-level meeting, but we invite the public and we want them to be able to attend virtually. So the meeting is going to be available November 8, 9, 10. We'll be here in DC. Only physicians and researchers can be in the room, but the public can sign on and attend virtually. That can be signed on at medstarhealth.org/NDUCI 2023. So medstarhealth.org/NDUCI. So new developments in understanding chronic illness 2023. And there you'll be able to hear literally some of the top researchers from around the world who are pioneering this field and helping redefine these conditions so that we can come up with better illnesses. And we're talking about people who are coming from Stanford and people coming from NIH and people from our National Institute of Health, people coming from Columbia and Georgetown. So they're really top researchers in the world, also Cambridge in England. So we want to bring these people together to educate the profession so that the patients can get better care. But we want to educate the patients so that they can ask better questions and so that they can take charge of their health and not have to be a victim of their illness. Or the medical profession sometimes.
I love that, how you empower the client to take charge of their health. I think that's a great stepping stone to feel that they're in the driver's seat and they're not disempowered and they have no control. So I really like how you do that. And to the listeners, I'll include those links that Gary mentioned in the show notes. So go directly to the show notes and you'll get a link directly to his book and directly to the conference that he mentioned in November. Now, your final concluding words, I'd love you to summarize as to what the listeners can best do to maintain a healthy immune system.
Well, it gets back to the basics, right? Sleep. You need to be getting 7-8 hours a night. If there are teenagers in your house, they need 9.5 hours. They don't ever get it, but they need it. Exercise, both strength training and aerobic, is necessary about 3 times a week. You need to watch your diet. You should have a clean diet. And we're finding now all of this stuff with the artificial sweeteners and whatnot are just poison. So the low-calorie stuff that people are drinking, low-cal Coke and stuff, it's just poison. It's horrible for your brain. Don't drink that stuff. You're much better off drinking the regular soda than you are drinking the artificially sweetened stuff, but I don't even want to encourage you to do that. Water is a lovely thing. We want to encourage you to drink water. We want to make sure that you're being attentive to your own emotional health, that you're being clean and clear with yourself. The more honest you are with yourself, the more clear you are in terms of what it is your needs are and whether or not you're being properly respected and addressed. We want people seen, heard, and respected in all aspects of their lives. And that's probably the single most important thing, because then you have a better sense of well-being and you're in an environment that supports your well-being.
Fantastic. I love what you shared today. It's very pragmatic. It's very much getting back to the basics and then seeing people that can really get an understanding of you as a person, what's going on and what's driving your conditions or your symptoms, and then help you address those. So I really appreciate you coming on the show, Dr. Gary Kaplan, and empowering the listeners to take charge of their health.
Anthony, I think what you're doing is brilliant. I think you're helping, tens of thousands of people with the work that you're doing, and I applaud it and delighted to be here today. So thank you.
Thank you so much, and have a great day. And to the listeners, please share it with others that you could see that could gain value from this episode, in terms of if they're suffering from any of the conditions that Gary mentioned throughout the episode. Please share it with them, as it could really help get them in the right direction and get their body to start healing themselves. So please share it with those in most need, and stay tuned in for more insightful episodes of Me&my Health Up. Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand Me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. Me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, Me&my Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast, and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages, or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of Me&my Health Up.